Hey everybody, it's Dr. Yola with a Coronavirus 2019 or COVID-19 update. As you know, Coronavirus 2019 has made it here to the United States. We were just made aware of our first positive case in my county just yesterday. And although it's concerning, it's not alarming. This is to be expected. Anytime a new or novel virus presents itself in human populations, we're going to see widespread infections with a large number of people affected. It's Public Health 101. But there are two ways in which we minimize the amount of spread once it's in our communities. The first is in our personal hygiene habits. It's making sure we do the 6 things that we talked about in my Coronavirus 101 video. It's washing your hands or using hand sanitizer. It's making sure that you cough or sneeze in the crease. Whether you think you have coronavirus 2019 or not, we all universally should be coughing and sneezing in the crease, right? Right in here. The third is to avoid contact with our eyes, our nose, or our mouths, as the virus is transmitted through respiratory droplets for the most part, and any contact between the respiratory droplets and either of those parts of our body increase our risk of infection. The fourth is to avoid contact with surfaces that may keep those respiratory droplets on them. That means doorknobs, grocery cart handles, people's cell phones, elevator buttons. If you can't avoid contact, make sure that you're wiping that stuff down. The fifth is avoiding hand-to-hand contact with other individuals, because let's be honest, not everybody's washing their hands. So instead, we're going to do some elbow bumps and some head nods to greet each other. And the sixth but most important part of it is if you are sick, particularly with a cough and fever, that you stay at home. 80% of those with coronavirus 2019 have very mild symptoms. So it's hard to know the difference between having coronavirus 2019 and having a pretty moderate cold. Just stay at home to minimize the risk to others in terms of acquiring the infection. The other part of minimizing our risk are the awesome public health professionals that we have in our cities, counties, and state and federally. They're doing a phenomenal job in terms of minimizing the amount of spread across the country. Let's talk about the scary stuff that's out in the media, the death rate. That's coming up over and over again in terms of coronavirus 2019, particularly as it compares to flu. It's important to understand how that death rate is calculated. It's the number of people who die from coronavirus 2019 over the total number of people who have the viral infection. It's important to understand that we aren't clear on the total number of people who have coronavirus 2019. That requires us to have a clear understanding of the number of people who actually have the infection. And as I mentioned before, with a majority of the people having very mild symptoms, those individuals aren't necessarily going to be counted in that denominator. And anytime you reduce the size of the denominator, the total percentage is going to appear higher. The other issue was that we were not standardly testing everybody. Historically, we were testing those who were in high-risk countries or had direct contact with someone with a positive coronavirus test. Now that we have, through institutions like LabCorp and Quest, the ability at our health centers to test people, my clinical suspicion is that we're going to have a better sense of the total number of people who have coronavirus 2019 infection. That's likely going to decrease the death rate that we are now calculating out at about 3.4%. Now, how does that compare to the flu virus in terms of the flu death rate? The flu death rate is at 0.2%, but we have to, again, understand that we know the total number of people who have the flu. When we present with a cough and fever, as a standard, most healthcare professionals will test people for flu right there on the spot. So it increases the total number of people that we know that are walking around with the flu. So clearly, we're going to have a lower amount of, a lower death rate for the flu than we will with coronavirus, simply because we know of more people who have the flu. As we test more people, as I mentioned before, I believe that the death rate will decrease based on just basic math. How does it compare to other significant viruses like severe acute respiratory syndrome or Middle Eastern respiratory syndrome? SARS had a death rate of about 10%, and MERS had a death rate of about 30%. So comparatively speaking, coronavirus 2019 has a lower death rate than more severe respiratory illnesses. Now, what do we do to protect ourselves other than personal hygiene, particularly if we end up developing coronavirus 2019? The best way to do it is to really maintain very good health habits. The better our health is, if and when we are exposed to the virus, the more minimal the symptoms will be, the faster we will be able to recover. That means making sure that we use food as medicine. There are specific foods that boost our immune system that include vitamin C, vitamin B6, vitamin D, vitamin E, and the element zinc. those help to strengthen our immune system. So as much of those foods that you can get that contain those, and it's not hard to do, if you simply eat the rainbow of fruits and vegetables, incorporating some legumes like chickpeas and lentils, that will help in terms of boosting your immune system. The other part of it is making sure that we maintain good gut health. The majority of our immune system actually exists in our gut. So it's making sure that we are maximizing our probiotics, making sure that if you eat yogurt, you get yogurt that has live cultures in it, to make sure that we're maintaining good gut health as we progress through this epidemic. The third is to make sure you're getting in enough sleep. Sleep deprivation weakens your immune system. So now is the time to get in your 6 to 8 hours of sleep. The other aspect of maintaining good health, and this is easier said than done, particularly in the middle of an epidemic, is to try to manage your stress. As hard as it is, trying to make sure that our cortisol levels aren't all over the place. When cortisol goes up, our immune system weakens and it increases our likelihood of becoming sick. The other part of it, particularly related to both cortisol and diet, is minimizing our sugar intake. Overconsumption of sugar can affect your immune system and your body's ability to recover once you develop an infection. For those who are at increased risk, particularly those with hypertension, high blood pressure, and diabetes, it's important to maximize control of those diseases so that if and when you end up developing coronavirus 2019, you have maximal health. For those individuals who have those conditions, you increase the likelihood of severe symptoms if your blood pressure and your blood sugar aren't under well control. So it's important for us to make sure that we're doing that. A lot of times people are asking, how long does it take to develop symptoms once you're exposed to coronavirus 2019? It's really anywhere between 2 to 14 days, with the average amount of time being about 5 days, but as long as 24 days. So this is when it's very important that if and when you develop cough and fever, that you stay at home, because you don't know if you're putting others at risk. I would definitely reach out to your healthcare professional. You don't necessarily need to go in unless you develop more significant symptoms. Use your wisdom. Anytime, even without coronavirus 2019, if you developed increased respiratory symptoms, you would see your healthcare professional anyway. Use that same guidance in these cases as well. But clearly, if you're developing more severe symptoms, shortness of breath, and as we talked about before, shortness of breath is when you feel winded at rest, as if you hadn't exercised in months and then you try to go out and run a 5K, with the caveat being for children and babies. They're not necessarily going to report out that they're feeling short of breath. You have to pull their shirt up, make sure you're looking at their chest to see if they're sucking in at the ribs. If that is happening, then that means you need to seek out medical attention for either you or your little one. 80% of people, as I mentioned before, have very mild symptoms. About 14% of people have symptoms significant enough to need to seek out medical attention. And then 6% of individuals are sick enough to require intensive medical care. This is disproportionately affecting our seniors, those with chronic medical conditions like diabetes and high blood pressure, individuals with sickle cell anemia and those other chronic medical conditions, and those who are immunocompromised. It's important that we protect those three populations, making sure that they have a clear understanding that if they develop cough and fever, that they would likely need to see a medical professional a little bit earlier than the general population. Specifically for our seniors, the CDC has now recommended that seniors avoid crowded environments, that they avoid travel as to minimize their risk. The majority of individuals who are dying from coronavirus 2019 have disproportionately been our seniors aged 65 and older, particularly our seniors in their 70s and beyond. So if you have a senior in your life, a neighbor, a friend, a family member, make sure that you are taking extra good care of them. Make sure that they have enough groceries to last them. Advise them to make sure that they have enough medicine for at least 2 weeks, so that if and when they end up having to stay at home, they have everything they need. I know that this is a very scary time, particularly as we hear more and more news reports about cases in every single state, but understand the natural pattern of infectious disease, I think, is important, but also making sure that we're maintaining good health habits. We've been in these positions before with H1N1, with SARS, with MERS. We are capable of being able to make it through this, but it's really being able to maintain good health habits, to not panic, and to seek out medical care when necessary. We're here for each other. We are each other's brother and sister's keeper, and it's important to remember that as we survive and thrive through this epidemic. As I get more updates, I will definitely keep you guys posted. Dr. Yola out.